Hello, dear students and esteemed learners. Welcome again. Welcome to our course on Sociology of Health. And this is the last lecture of fourth week. So, in this week, we were talking about medicalization and demedicalization. And in the last four lectures, we talked about multiple aspects related to the process of medicalization and demedicalization. Basically, we tried to understand meaning of the term medicalization. Then we try to understand the other processes like demedicalization, and then some of the other related situations like over medicalization and under medicalization, and in certain circumstances remedicalization also. And then we move to the two very important social philosophers, social critique, one Ivan Illich and the second one Michel Foucault. Now, Ivan Illich had a very critical view about medicalization. He talked about iatrogenesis, where he was talking about some of the medicine induced illnesses, talking about situations like over medicalization, although not making use of the term over medicalization. And then we also talked about Michel Foucault. Now, Foucauldian perspective is altogether different. We had talked about Foucault earlier also when we were talking about the theoretical perspectives. That time we discussed some of the important things. Now, in the lecture in this context, basically, we talked about the discourses, the medical discourses which take shape, and then the kind of power relationship basically come into existence because of some of those medical discourses. And then Foucault is also talking about medical gaze, and simultaneously he's talking about uh, medicine of the species and medicine of the social spaces. So many things Foucault is talking about. But along with those things, what is actually quite visible in those discourses or in those views expressed by Foucault, that power is operating in contemporary societies, and that is why Foucault is often talking about the administered society or the surveillance society. And Foucault's contribution basically is an effort to see how medicine as an institution or medical profession basically as a system is instrumental in handling the power situation, because at certain places Foucault is also saying that the humans and their bodies basically are subject for medical intervention and surveillance. So that kind of thing is basically appearing. And then Foucault is talking about the European society, which was actually uh, talking about, at some level, you can say that 20th century itself. So now the present topic is related to that, gender and medicalization. So in this topic, we will try to see how medicalization is influencing or affecting the notion of gender in the contemporary society. And that is why I briefly reviewed all the concepts that we have studied till now. So gender is an issue which is remaining much debated these days. We are having a different group of uh, people who take sides on some of the issues related to gender also. So, how we can identify the debates which are going on within the issues related to medicalization and gender? This lecture is basically a humble effort in this direction. And let me also share with you that some of the contents are actually part of, or some of the content are taken from some of the recent research, because in the textbook we won't find much of the updated information. So with this brief introduction and relevance of this lecture, we'll talk about the concept that I have covered in this lecture. And the concepts are gender and medicalization, then feminist view on medicalization, medicalization of reproduction, and then gender, medicalization, and social context. So all these are interrelated. We'll try to understand all of them. Now we can start by citing some of the important statements, because statements are very important and statements will give direction to our this lecture. Peter Conrad incessively examined the particular gendered aspect of medicalization. So there were so many people who were studying medicalization, and then there are gendered aspect of medicalization also, and Conrad is basically trying to understand that. Scholarly examinations of gender and medicalization, which have largely focused on the medicalization of women, have generally ignored the medicalization of men's lives. So, one understanding which is coming, that if we try to locate the concept of medicalization from gender's point of view, then we don't find enough studies conducted on men. Now, why this is happening? Some people have argued that men are not as vulnerable to medicalization as are women. The substantial literature on the medicalization of childbirth, premenstrual syndrome, menopause, and anorexia in women clearly shows that more of women's life experiences are medicalized than men. So, if we talk about why there is not much coverage to the men's issues in medicalization, then one group of people say that because women's life is having many more such situations where we can see the impact of medicine or medicalization, and that is the simple reason behind that. However, there are other interpretations also, other explanations also. One of several reasons analysts typically give for women's vulnerability to medicalization is the traditional definition of a healthy body. That means we are going one step further and trying to understand that how actually a body is constructed in the social and cultural milieu. On the one hand, Alan Peterson notes male bodies have been constructed through scientific and cultural practices as naturally different from female bodies. And the bodies of white European middle class heterosexual men have been constructed as a standard for measuring and evaluating other bodies. That means the way the concept of body is constructed, that is also one of the factors responsible for basically talking about or availability of literature on medicalization from gender's perspective. So the other viewpoint is coming from Risman. Now, Risman suggests that women are more vulnerable to medicalization than are men because their physiological process like menstruation, childbirth are visible. Their social roles expose them to medical scrutiny, and they are often in a subordinate position to men in the clinical domain. So there are so many things, basically few things talking about the gender role of women. Then few other things are talking about the biological functioning. And then one very important thing that is mentioned in this statement is the subordinate position to men in the clinical domain. That means it is stated that women's position in the clinical setup is not that of superordinate but that of subordinate. So some kind of power structure is basically operating or visible, and which is nothing but the reflection of the power structure which is existing in the larger society. And so we have tried to understand some of the views expressed by the feminist also. I think you all might be aware of the term feminist. Basically, feminist is a person or a group of persons who look at the problems from the perspective of the women. Now, depending upon to what extent basically they are varying from the other available discourses, those views are basically accepted or somehow sometimes criticized also, but that's a different issue. I hope that you got an idea about feminism, that feminists look at the problem from the female's perspective. For feminists, the focus has tended to be on how a male dominated medical profession as a result of patriarchal system has increasingly defined women's problems in medical terms and advocated medical interventions. So three things are quite visible here. First, how male dominated medical profession, that means it is stated that the medical profession is male dominated, and that is nothing but the replica of the prevalence of the patriarchal system. And then this medical profession has increasingly defined women's problem in medical terms, and that means all the problems of women which are necessarily or unnecessarily related or unrelated to medical issues have been defined like medical problem. And once those are defined as medical problem, then some kind of medical intervention is becoming quite obvious or natural. So women's problems are not necessarily needing medical intervention often according to the feminist, but because the profession is patriarchal, so it is suggesting some kind of medical intervention, and this is how medicalization is basically coming into picture. So that is one core argument from the feminist. This is manifested in studies of reproduction and birth control, childbirth, infertility, premenstrual syndrome, eating disorder, sexuality, menopause, cosmetic surgery, anxiety, and depression. That means a whole set of issues are identified here where some kind of ideological dominance of the male dominance in the profession is getting reflected. Feminist criticism, such as the British sociologist Anne Oakley in the book The Captured Womb, have accused a medicalized system of ignoring women's own preferences and experiences. Now, this is very important. Anne Oakley is a celebrated, basically, author. The book The Captured Womb is a very important book to understand some of the contemporary phenomenon. I recommend some of you to read also if you find enough time for that. Now, what is stated here? Anne Oakley says that the medicalized system have ignored the women's preferences and experiences. That means medical system or medicalized system is not listening to the women's voices, not taking care of the women's preferences and even women's experiences. Now, this is a very sharp kind of comment. In other contexts, women are similarly seen as the object of patriarchal medical control. For instance, over drugs, especially of the prescription of tranquilizers and surgery, and in general, the treatment of women within the medical system is accused of serving to enforce passivity and dependence. So, what we talked about when we were discussing Foucauldian perspective, we had stated that sometimes human body is becoming an object of control. And now that argument you can see is applied, but in the specific context of the women. Now, medicalization of reproduction. More recent research has focused on the social consequences of new reproductive technology such as genetic screening, in vitro fertilization, and fetal surgery healthcare. Now, these new reproductive technologies are also having different types of consequences and different types of mechanism. Some new reproductive technology have diminished women's control in decision making, while augmenting the power of professionals, social movement, or the state. That means the women's power as an agency, women's role as an agency is getting diminished because of some of the technological interventions. For example, the use of implantable contraceptives by the poor or by women in developing nations raises the specter of a powerful group or society controlling the fertility of the less powerful. So, implantable contraceptives basically do not necessarily take the will of the women or the consent of the women, because with the help of the technology those are implanted. Now once that is implanted, women don't have their the women don't have the control over the process, or their voice or their preferences will not count. So that is a kind of objectification also. Then medicalization of reproduction, there are few other arguments also. New diagnostic technology diminished the importance of women's experience of their bodies and forced them to depend on experts to interpret the new technologies. With the development of ultrasound, for example, women became less reliant on their own experiences of fetal movement, because when women are pregnant and before the arrival of basically the technology of ultrasound, then women basically used to observe the movement of the fetus, and so the agency of the motherhood was operating fully, or it was fully functional. But once we have the ultrasound technology, then the experiences of the mother, or the feeling of experiencing the movement of the fetus inside the womb, now that is becoming irrelevant or not very relevant. Why? Because that is basically no that is tried to be understood through the technology of ultrasound. So this is how the new technology is actually encroaching upon the agency of women, and especially in the role of motherhood. Then some commentators fear the potential of some new medical technology to devalue the mother while increasing the social value of the fetus. And at the same time, the fetus in itself is becoming an agency. And what is happening that sometimes, because of new technology or a new medical instruments, the unborn fetus could be identified as a patient, and he or she may get some kind of specific treatment, and in that type of situation the mother is actually often getting marginalized or reaching to the peripheral, and the fetus is basically at the core of the attention. So that kind of dissociation of the mother with the fetus inside her womb is also happening or taking place. So that kind of situation is actually creating a very problematic situation, and that is basically something that we are trying to understand by applying the concept of medicalization in this gendered context or medicalization of reproduction. Then again, something which is related to this very situation is like the fetal rights movement, that the unborn baby is still in the womb of the mother, but because that is a new agency, a separate agency, so there are claimants that people need to take care of the rights of the fetus also, and the context is basically very important. This trend has culminated in the fetal rights movement, in which African American mothers accused of using drugs have been prosecuted for allegedly endangering fetal health, or even forced to undergo cesarean sections. In these cases, women lose control of reproduction, which has been taken over by the state. So there are two things happening simultaneously. One is that people basically are becoming conscious of the rights of the fetus, and the second thing is this, that women are losing control over the process of reproduction, and the state is coming in between the fetus and the mother. So most critics of new medical technology do not simply assume that all medical technology are intrinsically harmful to women. So not necessarily all technologies are harmful for women. Many of these technologies have actually played a very important role in protecting the lives of women also. So when we have been talking about the impact of modern medicine, then certainly it should be noted that one of the very positive impact of medicine was in saving the lives of basically the mothers and the infants, maybe the unborn baby or maybe the baby is born but in remaining in a neonatal or infancy stage, because the world was witnessing high prevalence of infant mortality and maternal mortality. So the medical inventions, medical discoveries, and medical surgeries have certainly played a very positive role in protecting those lives. But what we are talking about here is this, that how medicalization, not medicine as such, but the process of medicalization, right? So by now I think we all have understood that making use of medicine is one dimension and the process of medicalization is another dimension. So here we are presenting, or we are talking about the problems which are associated with or which are related to the process of medicalization. Rather, most take the more nuanced view that the consequences of any technology depend largely on the social context in which it is deployed. So, when we talk about basically the positive role or negative role, then the context is becoming very important. Without taking into consideration the context, it will not be fair to talk about the positive or the negative role, because under different circumstances, under different situations, similar types of intervention may create different types of results. So uh, what is stated here is this, that the social context is very important. The social context is very important even in execution of medical techniques and medicines, right? So in this slide, I've tried to mention some of the very important situations which are actually playing a very crucial role in deciding or in locating the position of women in the discourses related to medicalization, right? So there are a few important points, and I think any student of sociology of health should have some kind of understanding about these contexts, because these contexts actually talk about the various social and cultural determinants that we have been talking about. So we were talking about a process which is known as medicalization, but how the context or the social and cultural determinants basically influence the process of medicalization itself. So this is something very important. And so, very briefly, I'll try to talk about all these important contexts. Now, when we try to understand gender and medicalization, then the role of patriarchy is becoming very important. Now, patriarchy is basically the unequal power structure prevailing in a society where the male are basically dominating over the female, right? So that is what is patriarchy. Now most of the feminist and the feminist critic say that most of the institutions in a patriarchal society are also patriarchal. So that is very important and that is very interesting, that if the society is patriarchal, then all the institutions existing in that society will also become patriarchal. And just like that, the medical profession will also become patriarchal. The family will become patriarchal. The state will become patriarchal. The hospitals will become patriarchal. Every possible situation or institution will become patriarchal. That means if patriarchy is prevailing, then at each and every possible situation or social situation, the women may get a secondary treatment or a subjugated status, and in this situation medicalization can operate against the interests of women or against the will of women. Then we can talk about the next thing, that is the race, caste and ethnic factors. Now race, caste and ethnic factors are also very divisive. We are a student of sociology. We have studied the process of stratification, which talks about the division of the society in different strata, right? So in certain societies we see that the society is divided in terms of race or caste or ethnic factor. So if the society is divided on the basis of this race, caste or ethnic factors, then some kind of structural inequality will prevail. And if there is a structural inequality prevailing, then that will definitely get reflected in the institutions like the medical institutions. That means society is basically characterized by inequality. That kind of inequality is getting reflected in the medical institution, and within those inequality the patriarchy is also prevailing. That means women are getting further subjugated, further marginalized, further vulnerable they are becoming. So that kind of context can create a very unexpected kind of situation, right? But because we want to understand the implications of this particular topic at a larger level, we need to think of those situations also. Then what kind of power structure is basically prevailing, the nature of the state and empowerment of the community. Now in a democratic country the situations could be different, in a totalitarian country or an autocratic country the situation could be different, and in a theological country, theological state, basically the situation could be further different, right? So we can talk about these context to understand the dynamics, the gender dynamics, right? Because gender dynamics is operating, but the external environment is also playing a very important role in deciding the discourses of that gender dynamics. Just like that, the role of the government or the legal system and the regulation of medicine is also very important. Medicine needs some kind of regulation, right? Because in modern societies basically the role of the state is defined, and everywhere some kind of regulation is required. So whether medicine is getting regulated or not, that is very important, because if there is no regulation then it will take its own course. And if we have some kind of understanding of the Foucauldian perspective or the Marxist perspective, then it will get reflected, or it will create, or it will construct the dominance of certain types. So within that kind of dominance which could emerge, locating the status of women could be a further challenge, right? So these are some of the situations that we can talk about when we look at the problem of medicalization from the gender's perspective. Similarly, I have also mentioned basically religion and belief system, then poverty and income inequality, then employment condition and work environment. Now work environment is again very important here, because if the work environment is very good, then it may reduce the kind of role conflict that women may have, right? So if the role conflict is reduced, then the mental health would be much better. And if the women is witnessing a kind of role conflict in a specific strange work environment, then that will be an additional burden. So whatever problems that the women workforce might be witnessing, if there is a negative kind of work environment, then that will further increase the complications. So that is again a very important context. And then marriage, age at marriage, then the reproduction, reproductive rights, and all those issues are basically very important. Some of these we have discussed also, and these will continue to decide the extent of or the level of medicalization that women may see or may have to face, and what kind of role basically they may have in those gendered situation. And then one last thing basically I would like to talk about, that the role of the status of the transgender is also very important. Now when we talk about gender and medicalization, then ideally we should take into consideration the male, female, and the transgender. I try to locate the position of genders within this medicalization discourse, but I could not have access to any appropriate literature on this. And I was not having enough time also, because we have not been talking about transgender in any of the previous lecture. So I would have needed to talk about that first. So I think we will include the issues related to transgender in one of the lectures when we will talk about the health of the vulnerable groups or marginalized groups. So with that kind of understanding, we have not included the issues related to transgender in this lecture. So with this, we can close this lecture. We talked about so many things, and some of these things are basically based on certain views and opinions also. So not everything could be considered as a fact, because at this level of understanding, we don't deal with everything which is fact. There are certain things we are uh, perceived understanding also, and that is why I tried to quote the people whose statement I used to take. Right. So here you have a think about this problem and activity question, and then uh, we'll meet in the next lecture. Till then, take care.